We're here today with Dr. Brandon Fletcher at Nostalgia Family Medicine in the Longwood area of Florida. Dr. Fletcher, you've seen close to, 800 medical marijuana patients now?
Yes, ma'am.
Yeah. What is your take on it personally?
In this last year and a half or so that I've been seeing these patients, I've found that it really has given so many people their quality of life back, and has made such a difference in their quality of life, and it's been very rewarding. It's probably, in my opinion, it's the most I've had the most professional satisfaction performing these certifications that I ever have in my career thus far.
That's exciting to hear. What types of conditions, I know there's a list of conditions that are acceptable in the state of Florida, but what are you seeing mostly for your medical marijuana patients?
Yes. Looking back at our demographics, the most common diagnosis I see in our office is a generalized anxiety disorder.
Wow, it seems to be very prevalent today.
It really is. We're taught in medical school that about 90% of what you see in any patient, or about 90% of your patients, has the component of an emotional disorder, and that's really I think that really comes through with seeing the demographics of the patients that we have.
So there's a lot of questions around CBD versus medical marijuana. What do you tell people when they're asking questions about that?
I see, yes. One of the things I really pride myself in is the amount of patient education that I give. And, we know there's this thing we call the endocannabinoid system that that's a system we're augmenting when we use medical cannabis. And I explain to folks that it's important to have a balance of both CBD and THC. There's this phenomenon called the entourage effect, and what that is when you use THC in combination with CBD, you get a much better effect. And we know that because the CBD actually helps to keep the THC in circulation longer, so it allows for the THC to actually have a longer lasting effect. In addition to that, on the emotional type disorders, depression, anxiety, and those kind of things, we know that THC actually causes stimulation of serotonin and dopamine that helps to control our mood and depressive symptoms, and the CBD actually inhibits the serotonin and dopamine's breakdown. So the combination is, especially when you're dealing with an emotional disorder, it's extremely important to have a good amount of both, and it really gives you the best overall result generally. Almost all of my patients that follow my recommendation and making sure they're getting a good amount of CBD along with whatever THC products they need, they come back and really appreciate that advice, and they find that recommendation is probably the most effective recommendation of any that I've found.
Okay, so can you speak to the different routes or administration of the medical marijuana?
Yes, sure. So in the state of Florida, there are several different routes of administration. There is the smokable route, which is set, and there's also an inhalation route. And the differences in those two are, the smokable route is when you're using what we call whole plant medicine, which is generally when you're going to use the cannabis and you're going to either smoke it in a marijuana cigarette, or either you're going to put it in some form of a vaporizer device and vaporize it. We call that dry herb vaping. The inhalation route is primarily for vaping the oils, the vape cartridges. And then after that, then there's an oral route, which is what it sounds like. It's meant to be taken orally and swallowed. Then there's a sublingual route, which allows for sublingual absorption to put an oil under your tongue and then allow that to dissolve. Then there's, or absorb I should say. Then there's also a, let's see, so we said smokable inhalation. I'm sorry, I'm checking myself here. Oral, sublingual, and then topical. And then the topical includes, of course, sunscreens, lip balms, in addition to creams and lotions. And then there is one more I forgot, and that is this, the suppository route, as well as the last route.
Okay, so you have this discussion with your patient, don't you?
Yes, and how I do my recommendations is I call it a blanketed recommendation, and by that what I mean is this is completely individualized to every person that comes through my door, and I explain to them the reason I give this kind of blanketed recommendation is because that allows them the opportunity to figure out what's going to work best for them, because remember, everything I do is a recommendation, different than when in the traditional system people go to the doctor and they get a handwritten prescription, or nowadays an electronic prescription. This is solely a recommendation, so I can explain everything to them, very, very detailed. But when the patient goes into the dispensary, it's ultimately their decision to decide what product they would like to purchase. So I go through and explain all the different routes. The one route I don't automatically give is a suppository route, because that's usually in someone that is really close to the end stage of their life. For some reason they can't take anything orally. So generally that's not a route that's going to be preferred. So the way I do my recommendations is I give an oral, a topical, and an inhalation route, plus or minus smokable if they want that route, in medical marijuana, which is the high THC marijuana and low THC marijuana, or CBD. So the patients really have the opportunity to figure out what's going to be in their best interest, and then depending on what we are treating, I do steer them one way or the other. It just depends on the situation.
And then they take that and go to the dispensary and then get the whatever it is, whatever route they're going to, or whatever product, whether it's sativa, indica, whatever it is.
That is correct. So when they come for their follow-up appointment, and then we get everything in the system, and then they leave the office, then they can go to any dispensary they like, and then that's where they would, and purchase their medication. Yeah.
Okay. How do you get around the stigma of maybe someone who's always heard that that was a gateway drug, or that was something, the stigma of marijuana itself has its own stigma, and now the medical marijuana side, we're seeing all the medicinal purposes for it. How do you get around that stigma?
So generally how I approach it is this: I educate. A lot of people either have forgotten or don't know that actually the Webster definition of physician or doctor is educator. And so I educate them primarily on, obviously, the endocannabinoid system. Most folks don't realize that we all have a human endocannabinoid system, and then when I explain to them the similarities of the endocannabinoids that we naturally make in our body, and the relation, and how closely related, I should say, the phytocannabinoids, THC and CBD, amongst the other ones that we know of, from the marijuana plant, how closely they are related, and the functioning of both our endocannabinoids, and how it relates, how the medical marijuana relates to the function of those endocannabinoids that we make. And usually after educating them on that, that helps them to understand, wow, okay, so this is, this isn't, kind of voodoo or anything. I mean, and then I explain, get in a little more detail with the different receptors and how everything works. And because a lot of times people want to know how the THC works and how the CBD works as well. And so I'll go into somewhat detail depending on how detailed they like me to be, to explain to them what we're really doing. Because the one thing I do, one thing is for sure, if someone is not comfortable with a treatment regimen, and that doesn't necessarily have to be medical cannabis, that could be anything, high blood pressure or any of that. If they're not really comfortable and understand why they're doing it, they're a lot less likely to be compliant with that treatment. So that's where the education piece comes in my opinion, that the patient education has to be paramount.
Okay, so speak to the other providers out there that may have a patient base and they're wanting to get certified because their patients are now coming to them and seeing them. Doc, can I get, medical marijuana for this? How can you encourage other providers out there that there is this whole medicinal purpose for it, and it's not really stigmatized to add that into your existing practice?
So I'm just making sure I understand the question. How would I help this provider
who's wanting to offer this to
I see.
patients, but doesn't really know, how to get started?
Right. So I would direct them to the Florida Medical Association, FMA. They have an online certification course. That's the first thing you have to do, is take the certification course, and then once you pass that, then you can go to the Medical Marijuana Use Registry, and then you can register as a patient or you can register as a physician. Then you put your registration in there, and then hang out your shingle.
And then experiential from there, right?
I'm sorry?
It's experiential from there.
Yes, right. That's exactly right. And then, there's a lot that goes into it as far as kind of how to approach it. There's no guideline, if you will. There's there's really no regulation, so that goes anywhere from how you set up your clinic to the pricing structure that you may use. All of that is completely up to the provider and the office. So there's really not necessarily a wrong way to start, to set it up. The key is getting that certification completed and then getting registered with the state so they know you're a certifying physician. Absolutely.
Is there anything you want to leave our patients with, or anyone that's thinking about medical marijuana, encourage them?
Sure, right, yeah. If you're looking at medical marijuana as a possible treatment option, the studies are there. I've had so many patients come back and explain to me that their quality of life was so much better, and they're able to get out and about, and I would just highly recommend, if please, I'd be happy to do anything. If you have any questions, just let us know. But please, you would be making the right decision if they decided to go ahead and get their medical marijuana card. I think they would not be disappointed in their decision, for sure.
That's great. Thank you, Dr. Fletcher.
Yes, ma'am. Thank you.